fired up? So today, we're here to show visible support for an amazing opportunity that Montana has. Our legislature can choose to accept federal dollars and offer access to health insurance for over 60,000, as many as 70,000 Montanans who, for their families, health insurance has been financially out of reach. And that is a big deal. And that is a good deal.
On a regular basis, I see patients who need a particular test or who need to follow up with me closely until we stabilize their chronic disease. And they simply tell me, "I can't do that, doc. I have no insurance." These words have become too familiar to me since I've moved to Montana 18 months ago. Here, my treatment plans are not necessarily based on the evidence or what I know from experience, but it's a series of negotiations on what my patient can afford and calculated risk and benefits of each option. With Medicaid expansion, we can do better than this.
Medicaid has been there for my children and I. Medicaid provided the opportunity to have a clean, safe, and sterile environment to give birth to my daughter 9 years ago, and not in a world of debt after the hospital delivery and all it entailed. My daughter was able to receive monthly checkups, vaccinations, and other necessary doctor's visits from birth on. At that time, I was attending school full-time and working over 30 hours a week while raising my 2 children on my own. My son, who is now 19, was eligible for Medicaid when he was younger. He was born with mild cerebral palsy. Medicaid paid for his occupational, physical, and speech therapy visits, as well as all his other doctor visits. Thanks to all the therapies, most do not know my son has a disability today. And this is due to the services we were able to access through Medicaid.
The healthcare plan that I have now, they ask me, they say, "What's the healthcare plan that you live along the lines?" Is just basically convince yourself you're not in pain. And it's okay, because it's part of life. You're getting old. Accept it. So, right now, that's basically my healthcare.
In this legislature have a historic choice to make and a historic opportunity to improve the lives of 70,000 Montanans at a single stroke. And we have a simple choice to make. Should we expand our Medicaid system or not? Governor Bullock has answered that question in the affirmative via House Bill 590, but has proposed not only expanding Medicaid, but transforming our Medicaid system as well.
It's no secret that our system's broken. We pay too much, we get too little. Far too many families are one medical emergency away from bankruptcy. And time again, as we look forward, we're not getting the results we need out of this system. We can do better. Amen. We can cover another 60 to 70,000 Montanans. We can reform our system so we're actually making sure people are staying healthy, not just dealing with them at moments of crisis. And for a legislature so concerned about jobs, we can create 13,000 jobs right here in Montana.
Whose house?
Our house!
Whose house?
Our house!
Y'all fired up?
Ready to go!